Welcome to Science Era. In this video, we're going to focus on part B from the muscular system. We're going to look at the muscle movement, role and names of the muscles. We're going to name the skeletal muscles, gross anatomy of skeletal muscles, and then we're going to look at the development aspect. Let's begin with 5 golden rules of skeletal muscle activity. The 5 golden rules are: number 1, with few exceptions, all skeletal muscles cross at least one joint. Number 2, typically the bulk of skeletal muscles lies proximal to the joint crossed. Number 3, all skeletal muscles have at least two attachments, the origin and the insertion. Skeletal muscles can only pull, they never push. During contraction, a skeletal muscle insertion moves towards the origin. So these are the 5 golden rules for the skeletal muscle activity. Next, type of ordinary body movement. First one is flexion. Flexion is a movement that reduces the angle of a joint and brings two bones together, closer together. It is usually done in sagittal plane. Flexion is common at ball and socket joint as well as the hinge joint. Bending the knee or elbow, for example, bending forward at the hip, is all the examples of flexion. Then we have extension. Extension is inverse of flexion and it is a movement in which the angle or distance between two bones or components of the body is increased. Straightening the knee or elbow is the example of extension. Then we have hyperextension. Hyperextension is defined as the extension of more than 180 degrees, such as when you move your arm posteriorly beyond its real anatomical position or tilt your head such that your chin points toward the ceiling. Next is rotation. A bone longitudinal axis moves when it rotates. The movement of the atlas around the center of the axis, as in shaking your head for no, is described by rotation, a common motion of ball and socket joint. Next is abduction. Abduction is the movement of a limb away from the body's midline or median plane, usually on the frontal plane. When your fingers or toes are split out, the term also refers to as fanning movement of your fingers or toe. Adduction, another term, is the opposite of abduction, so it is the movement of a limb towards the body midline. Think of adduction as adding a body part for by bringing it closer to the trunk. Then we have circumduction. Circumduction is a term used to describe a combination of flexion, extension, abduction, and adduction in ball and socket joint, like the shoulder. The limb's proximal end remains fixed while the distal end rotates in a circle. When you do huge arm circles, the entire limb forms a cone. So, this is an example of circumduction. Then we have special type of movements in the body. First is plantar flexion or dorsiflexion. These are two of the most common types of flexion. Special titles have been given to up and down foot movement near the ankle. Dorsiflexion is lifting a foot so that its superior surface approaches the shin, pointing your toes towards your head, whereas plantar flexion is pointing of the toes away from the head. Plantar flexion refer to the flexion of the hand, whereas dorsiflexion correspond to extension and hyperextension of the hand at the wrist. Then we have inversion and eversion. These are two different type of foot movement. Turn the sole medially as it's staring at the bottom of the foot. To invert the foot, turn sole laterally to avert the foot. Supination and pronation are two different ways of moving your body. Supination and pronation relate to motion of the radius around the ulna. Supination occurs when forearm rotates laterally, causing the palm to face anteriorly or up, and the radius and ulna to be parallel as in the anatomical position. When the forearm rotates medially, the palm forward faces backward, which is known as pronation or down. The radius crosses the ulna in pronation, forming an X between the two bones. Supinating is the act of lifting a cup of soup to your lips with your palm. So, pronation, radius rotate over ulna, spination, radius and ulna are parallel. Opposition. The opposition saddle joint between metacarpals 1 and the carpals allows the thumb to be opposed in palm of the hand. The motion of moving your thumb to contact the tip of the other fingers on the same hand is known as this. The human hand is an excellent tool for gripping and manipulating the object because of this distinctive movement. Then we have the summary of all the special movement. Dorsiflexion, lifting the foot; plantar flexion, depressing the foot; inversion, turn foot inward; eversion, turn foot outward; eversion, turn foot outward; supination, hand facing upward; pronation, hand facing downward. Then we have opposition, touching thumb to other finger. Types of muscles: prime mover, synergist, antagonist, and fixator. Prime mover, muscle with major responsibility for a certain movement. Then we have antagonist, muscle that opposes or reverses a prime mover. Synergist muscles that aids a prime mover in the same movement and help prevent rotation or unwanted movement. Then we have fixator. Fixator stabilizes the origin of a prime mover, so all tension can be used to move the insertion bone. Muscle action. A muscle that crosses on the anterior side of a joint produce flexion. For example, pectoralis major, you can see the anterior view in the diagram. Then a muscle that crosses on the posterior side of a joint produce extensor. For example, latissimus dorsi, you can see posterior view. The latissimus dorsi is the antagonist of the pectoralis major. Then a muscle that crosses on the lateral side of a joint produce abduction. For example, deltoid middle fibers. You can see the anterolateral view in the example. Then a muscle that crosses on the medial side of a joint produce adduction. For example, teres major. You can see in the diagram posterior lateral view. The teres major is antagonist of the deltoid. Naming skeletal muscles. There are seven criteria used when naming the skeletal muscle. The first one is the direction of muscle fiber. Some muscles are named in reference to some imaginary line, usually the middle line of the body or the long axis of a limb bone. When a muscle's name includes the term rectus, which means straight, its fibers run parallel to the imaginary line. For example, rectus femoris is the straight muscles of the thigh. Similarly, term oblique in a muscle's name tell us you the muscle's fiber run obliquely or at a slant to the imaginary line. The second criteria is the relative size of the muscle. Such terms as maximus mean largest, minimus means smallest, and longest mean long are sometimes used in the names of the muscles. For example, gluteus maximus is the largest muscle of the gluteal muscle group. The third is location of muscles. Some muscles are named for the bone with which they are associated. For example, temporalis or frontalis muscles overlie the temporal or frontal bone of the skull, respectively. Then we have number of origins. When term bicep, tricep, or quadriceps form part of the muscle name, you can assume that muscle has two or three or four origin, respectively. For example, bicep muscles of the arm has two head or origin and the tricep muscles have three. Location of the muscles origin and insertion. Occasionally, muscles are named for their attachment site. For example, the sternocleidomastoid muscle has its origin on the sternum, which means sterno, and clavicle, cleido, and inserts on the mastoid process of the temporal bone. So, the name is sternocleidomastoid muscle. Then we have shape of the muscle. Some muscles have distinct shape that helps to identify them. For example, the deltoid muscles is roughly triangular. Deltoid means triangular. The last one is action of the muscle. When muscles are named for their action, terms such as flexor, extensor, abductor appears in their name. For example, the adductor muscles of the thigh brings about its adduction, and the extensor muscles of the wrist all extend the wrist. Then we have arrangement of fascicles. A fascicle is a bundle of muscle fiber enclosed by perimysium. First one is circular. Fascicle arranged in concentric rings surrounds external body opening closed by contracting circular muscles or sphincters. Then we have convergent fascicles. Convergent fascicles converge towards a single insertion tendon. Muscles appear triangular or fan shaped. Parallel fascicles run parallel to the long axis of the muscle strap-like appearance, then fusiform modified parallel arrangement spindle-shaped muscles with expanded midsection. Then we have pinnate. Pattern fascicles are short and attached obliquely on a slant to a central tendon. There are three types: unipinnate, bipinnate, and multipinnate. Unipinnate fascicles insert into only one side of the tendon. Bipinnate means two. Fascicles insert into the opposite side of tendon, and multiple pinnate fascicle insert into the many different side of the tendons. Head and neck muscles. The first one is frontalis. The frontalis, which covers the frontal bones, run from the cranial aponeurosis to the skin of the eyebrow, where it inserts. This muscle allows you to raise your eyebrow as in surprise and to wrinkle your forehead. At the posterior end of the cranial aponeurosis is the small occipitalis muscle, which covers the posterior aspect of the skull and pulls the scalp posteriorly. The second one is orbicularis oculi. The fibers of the orbicularis oculi runs in circular circles around the eye. It allows you to close your eyes, squint, blink, and wink. Next one is zygomaticus. Zygomaticus extend from the corner of the mouth to the cheekbone. It is often referred to as smiling muscle because it raises the corner of the mouth. The next one is buccinator. The fleshy buccinator muscles run horizontally across the cheek and inserts into the orbicularis oris. It flattens the cheek as in whistling or blowing a trumpet. It is also listed as chewing muscles because it compresses the cheek to hold food between the teeth during chewing. Next is orbicularis oris. The orbicularis oris is the circular muscles of the lip, often called the kissing muscles. It closes the mouth and protrudes the lips. Then we have platysma. The platysma is a single sheet-like muscles that cover the anterior lateral neck. It originates from the connective tissue covering of the chest muscle and insert into the area around the mouth. Its action is to pull the corner of the mouth inferiorly, producing a downward sag of the mouth, the sad clown face. Then we have temporalis. The temporalis is a fan-shaped muscles overlying the temporal bone. It inserts into mandible and acts as a synergist of the masseter enclosing the jaw. Then we have masseter muscles. Masseter, as it runs from zygomatic process of the temporal bone to the mandible, the masseter covers the angle of a lower jaw. This muscle closes the jaw by elevating the mandible. Then we have sternocleidomastoid. The paired sternocleidomastoid muscles are two-headed muscles, one found on each side of the neck Of the two heads of the each muscles, one arises from the sternum and the other arises from the clavicle. The head fuses before inserting into the mastoid process of the temporal bone. When both sternocleidomastoid muscles contract together, they flex your neck. It is the action of the bowing the head that led some people to call these muscles the prayer muscles. If just one muscle contract, the face is rotated towards the shoulder on the opposite side and tilts the head to its own side. Then we have trunk muscles. The trunk muscles include muscles that move the vertebral column, most of which are posterior anti-gravity muscles. Next one is anterior thorax muscles, which moves the rib, head, and arm. Then muscles of abdominal wall, which holds your guts in by forming a natural girdle and helps to move the vertebral column. We're going to look at each type of trunk muscles. Anterior trunk muscles. First one is pectoralis major. It is a large fan-shaped muscles covering the upper part of the chest. Its origin is from the sternum, shoulder girdle, and the first six ribs. It inserts on the proximal end of humerus. This muscles form the anterior wall of axilla or armpit and act to adduct and flex the arm. Then we have rectus abdominis. The pairs strap-like rectus abdominis muscles are the most superficial muscles of the abdomen. They run from the pubis to the rib cage enclosed in an aponeurosis. Their main function is to flex the vertebral column. They also compress the abdominal content during defecation and childbirth. They help you push and are involved in forced breathing. Then we have external oblique muscles. They are paired superficial muscles that make up the lateral walls of the abdomen. Their fibers run downward and medially from the last eight ribs and insert into ilium. Like the rectus abdominis, they flex the vertebral column, but they also rotate the trunk and bend it laterally. Next is transversus abdominis. The deepest muscle of the abdominal wall, the transversus abdominis, has fiber that run horizontally across the abdomen. It arises from the lower lip and iliac crest and insert into the pubis. This muscle compresses the abdominal contents. Next is internal oblique muscles. The internal oblique muscles are paired muscles deep to the external obliques. Their fibers run at a right angle to those of the external oblique. They arise from the iliac crest and insert into the last three ribs. Their function are same as those of the external oblique. Trunk muscles. Posterior trunk muscles. The first one is trapezius. Trapezius muscles are the most superficial muscles of the posterior neck and upper trunk. When seen together, they form a diamond or a kite-shaped muscle mass. Their origin is very broad. Each muscle runs from the occipital bone to the skull down the vertebral column to end of the thoracic vertebra. Then they flare laterally to insert on the scapular spine and clavicle. The trapezius muscle extend the head, thus they are antagonists of sternocleidomastoids. They can also elevate, depress, adduct and stabilize the scapula. Then we have latissimus dorsi. These muscles are two large flat muscles that covers the lower back. They originate on the lower spine and ilium and then sweep superiorly to insert into the proximal end of the humerus. Each latissimus dorsi extend and adducts the humerus. These are important muscles when arms must be brought down in power stroke as when swimming or striking a blow. Next is erector spina. Erector spina group is prime mover of the back extension. These paired muscles are deep muscles of the back. Each erector spina is a composite muscle consisting of three muscles column, longissimus, iliocostalis, and spinalis that collectively span the entire length of the vertebral column. These muscles not only act as powerful back extensor or erector, but also provide resistance that helps control the action of bending over at waist. Next is quadratus lumborum. The fleshy muscles form the part of posterior abdominal wall acting separately. Each muscle of the pair flexes the spine laterally. Acting together, they extend the lumbar spine. These muscles arises from the iliac crest and insert into the upper lumbar vertebra. Then we have deltoid muscles. Deltoids are fleshy, triangle shaped muscles that form the rounded shape of your shoulder. Because they are so bulky, they are a favorite injection site when relatively small amount of medication, less than 5 ml, must be given intramuscularly into the muscle. The origin of each deltoid winds across the shoulder girdle from the spine of scapula to the clavicle. It inserts into the proximal humerus. The deltoids are the prime mover of the arm abduction. Muscles of upper limb. First one, bicep brachii, is the most familiar muscle of the arm because it bulges when you flex your elbow. It originates by two heads from shoulder girdle and inserts into the radial tuberosity. This muscle is powerful prime mover for flexion of the forearm and act as the supinate forearm. The best way to remember its action is to think of opening a bottle of wine. The biceps supinate the forearm to turn the corkscrew and then flex the elbow to pull the cork. Next is brachialis. This lies deep to bicep brachii, and like the bicep is a prime mover in elbow flexion, the brachialis lifts the ulna as bicep lifts the radius. Then we have brachioradialis. This is a weak muscle that arises on the humerus and insert into the distal forearm, hence it resides mainly in the forearm. Tricep brachii. It is the only muscle fleshing out posterior humerus. Its three heads arise from the shoulder girdle and proximal humerus, and it inserts into the olecranon process of the ulna. Being the powerful prime mover of elbow extension, it is antagonist of the bicep brachii and brachialis. This muscle straightens the arm, for instance, to deliver a strong jab in boxing. Muscles of upper limb. The first muscle we're going to discuss is gluteus maximus. Gluteus maximus is a superficial hip muscle that creates the majority of buttock tissue. It is a strong hip extensor that pulls the thigh into a straight line with the pelvis. It starts at sacrum and iliac bone and ends on the femur gluteal tuberosity and massive tendinous iliotibial tract. Then we have gluteus medius. This runs beneath the gluteus maximus from the ilium to femur. The medius is a hip abductor that helps to keep the pelvic stable during walking. It's also a good place to give intramuscular injection, especially if you are doing more than 5 ml. Because the big sciatic nerve runs through the medial region of each buttock, this area must be avoided at all costs to avoid the nerve damage. Imagine the buttock is divided into the four equal quadrants to accomplish this. The gluteus medius muscle is then overlaid by the superolateral quadrant, which is normally a very safe place for an intramuscular injection. Physical harm from needle or degeneration of nerve from injection at or near sciatic nerve are both possible outcomes. Then we have the iliacus and possess iliacus osseous major muscles are fused together to form iliopsoas. It travels deep into the pelvis from iliac bone and lower vertebra to the lesser trochanter of the femur. If flexion is aided by the muscle, it also prevents the upper body from falling backward while standing upright. Adductor muscles. Group of muscle mass at medial side of each thigh. The adduct are adduct or the press the thigh together, they tend to become flabby very easily. The adductor have their origin on the pelvis and insert on the proximal aspect of femur. Muscles of lower limb. Group of hamstrings. The hamstrings are the muscles that make up the posterior thighs muscle mass. The bicep femoris, semimembranosus, and tendinosus are three muscles that start from the ischial tuberosity and run down the thigh. Inserting on both sides of proximal tibia, thigh extension and knee flexion are mostly controlled by them. Then we have sartorius. Sartorius is a muscle with a slender strap-like appearance. It is nevertheless the thigh's most superficial muscles. From the interior iliac crest to the medial side of tibia, it runs obliquely over the thigh. The thigh flexor is weak. Sartorius is known as the tailor muscle because it helps tailor sit with both legs crossed in front of them by acting as a synergist. The last one is quadricep group. These group comprise of four muscles that flesh out the interior thigh, the rectus femoris, and three vastus muscles. The femur give rise to the vastus muscles, while the pelvis give rise to the rectus femoris. The parallel ligament connect all four muscles to the tibial tuberosity. The group as a whole act to powerfully extend the knee because the rector femoris traverses two joints, the hip and knee. It can aid in hip flexion. The vastus lateralis and rectus femoris, especially in newborns with underdeveloped gluteus muscles, are sometimes used as intramuscular injection sites. So these were the muscles of lower limb. Another one is tibialis anterior. The tibialis anterior is the superficial muscles on the interior leg. It arises from the upper tibia and then runs parallel the anterior crest as it runs to the tarsal bone. Where it inserts by a long tendon, it acts to the dorsiflex and inverts the foot. Next is extensor digitorum longus. Lateral to the tibialis anterior, the extensor digitorum longus muscle arise from the lateral tibial condyle and the proximal three quarters of fibula and insert into phalanges of the toes. 2 to 5, it is a prime mover of toe extension. Then we have fibularis muscles. The three fibularis muscles, longus, brevis, and tertius, are found on the lateral part of the leg. They arise from the fibula and insert into metatarsal bone of the foot. The group plantar flexes and everts the foot, which is antagonistic to the tibial anterior. Next one is gastrocnemius muscle is a two-bellied muscles that form the curved calf of the posterior leg. It arises by two heads, one from each side of the distal femur, and inserts through the large calcaneal or Achilles tendon into the heel of the foot. It is prime mover for plantar flexion of the foot. For this reason, it is also known as toe dancer muscles. If calcaneal tendon is severely damaged or cut, walking is very difficult. The foot drag because it is not able to push off the toe or raise the heel. Next is soleus deep. Soleus is deep to the gastrocnemius is the fleshy soleus muscles because it arises from the tibia and fibula rather than femur. It does not affect knee movement. But like the gastrocnemius, it inserts into the calcaneal tendon and is strong plantar flexor of the foot. Next, we have development aspect of muscular system. Increasing muscular control reflects the maturation of nervous system. Muscle control is achieved in a superior or inferior and proximal and distal direction. To remain healthy, muscle must regularly exercise. Without exercise, they atrophy. With extremely vigorous exercise, they hypertrophy. As we age, muscle mass decreases and muscles become sinewer. Exercise help to retain muscle mass and the strength. So exercise is very important for muscular system. This brings us to the end of muscular system. Thank you for watching. I hope you like my video. Don't forget to subscribe for more.